Today we're discussing a medication that has shown potential benefits as it relates to things like long COVID, Alzheimer's, autism, and even depression. Stay tuned to this episode to learn more about the seeming infinite possibilities of this medication. Well, I'm not really sure what we're going to talk about today, but it looks like you had a run-in with a Smurf.
Poor guy didn't make it.
So what exactly is on tap for today? Why is this so blue?
I put on blue today too, actually.
Oh, wow.
Today we are going to talk about the infinite possibilities of methylene blue, which is actually methylene blue from our lab.
But isn't that an older drug? Like, what is so new about it?
Well, it is an older medication, and it's actually, we still have it in use in the pharmacy in many medications like Urabel and some other urinary tract anti-infectives. So, there's definitely medications that are in now with that, but there's also, back in the day, this drug has been around. This compound, goes back years, but in the 1800s it was used. So it's been for many years.
Okay, and then today, apparently, there's new research that shows some potential benefits for some other conditions, I guess?
Yeah, we always look for, all the latest information, and we're looking for, sometimes things are great, medications for a particular disease state or condition, and other things can be supportive. And so I think that's what they're looking for in the use of methylene blue now, but they're looking for it for long COVID, Alzheimer's, autism, even depression.
Oh, wow.
So it's again, as a supportive. There's always usually not just one thing that helps work for a lot of these things. So these conditions. So it's you have to understand it's a supportive therapy. But
and of course, talk to your doctor, talk to your prescriber. This is considered general advice, and we're sharing some new potentials and possibilities, and that some studies have shown. Of course, all of these things are still very much in research and things like that, right?
Yeah, I mean, there's much more research than there's ever been. I mean, and we'll get to that in a little bit. But I think that a lot of people ask how this whole medicine even works, methylene blue, because people are more obviously familiar with it as either a reagent for lab use or for as an anti-infective in some medicines. But well, basically, to better understand how methylene blue works, you have to go back to your microbiology days, painful as that may be.
Sounds
and on your cellular level, what this does is the methylene blue apparently is stimulating the mitochondria, which ends up
what?
The mitochondria. The mitochondria is almost like, when power goes out and you have like your whole house generator or those things.
Sure.
So the mitochondria, for each cell, there is like a whole house generator, if you will, that runs that cell. So this way there's always power going.
So it's like cellular energy boost.
Right. And that energy, when it kicks on the mitochondria is stimulated and there's that energy boost, there's an increased production of nitrous oxide, which has a variety of effects that are being studied, one of them to increase blood flow.
Okay, but this is not like a caffeine-related energy boost, right? Like how would you feel this?
No, that's a very good distinction to make that, because this is on a cellular level. So, while you can look at certain disease states that we're talking about today, like long COVID, for example, where people absolutely have no energy, so they do need energy, and they're feeling a lot of malaise and stuff. But no, you're right. It's on the cellular level. So you're increasing the energy. But when the cells are working better and the cells are healthier, overall your body functions better, and overall you're healthier in general. So
okay. And you mentioned briefly the long COVID thing. So what else can it potentially help with?
Well, I mean, as I mentioned earlier, we were looking at papers that were reviewing it for use in autism, depression, and long COVID, among other things. Yeah.
But how specifically? Like you mentioned Alzheimer's, right? So what does the cellular energy have to do with Alzheimer's?
Well, because for Alzheimer's in particular, you're just talking about, again, cellular things, and so the health of the neuron is so important. So when you look at the cells of people that have Alzheimer's and the brain cells, and just the plaque buildup and things, there are significant evidence of unhealthy cells. So the idea is to keep, if the cells are, the neurons in this case, are healthier, they can function better, and you ostensibly have better, overall mental acuity. I mean, ideally, again, a supportive role here. This drug has in there,
Sure. Okay. And then the mitochondria for autism. Then I guess, is there a similar kind of effect there?
Well, for autism or for the long COVID thing, it's more about stimulating the mitochondria again to produce more energy, and then produce increased blood flow, and that's where we're seeing in the supportive role, oftentimes with autism and with long COVID paired with LDN, low dose naltrexone, you're seeing some interesting results. And what we're really encouraged by is that, if you looked maybe 10 or 15 years ago and you looked on PubMed or Google Scholar, there were very few articles on methylene blue. Now, if you look on there are thousands, north of 20,000. So
and PubMed obviously is very reputable.
Right, and so exactly. Studies, so you're there's more and more research being done, and it's worth looking at. And if a person's suffering from one of these disease states and isn't improving, sometimes it's worth adding. Going to a practitioner again who's more well versed in these kinds of therapies to help them see if that may help.
This kind of reminds me of the whole anti-aging movement. Would you say it's kind of similar, even though we're talking about different conditions here, but it seems like it's kind of analogous to the anti-aging stuff in some ways?
Well, certainly when you're talking about things like with Alzheimer's or if you're improving the cell health, it is sort of keeping us younger and keeping the cells healthier. So in a way, it is an anti-aging thing.
So then let's talk practically speaking. So how is this? I'm honestly not sure how it's even kind of delivered or method of delivery in the retail setting, but retail versus compounds, or these capsules, what exactly does that look like?
Well, methylene blue is either dosed in a capsule or a solution. Now, one of the reasons we this is not actually the remnants of a Smurf. If you do end up getting a compounded solution, it's equally as effective as a capsule, but it's very likely to stain whatever
clearly.
So that it was more of just a visual to let people know about that.
Okay, fair enough. So is there anything? Sometimes when we've talked about, and the whole point of compounding, and specifically is customization and making patient-specific medication. So is there a sweet spot for methylene blue like there is for other types of compounded medication?
Sure. Again, using either a solution, 1% solution, or capsules, we usually try to get people on starting them around 10 milligrams to 30 milligrams, but always starting lower is where we want to go with that, and then slowly increasing it to see how it's tolerated.
Okay, fair enough. Now, when we talk about a lot of things like that, it always seems this is a miracle or it's a panacea or whatever. What are some side effects or potential downsides to this medication? Have you heard of anything like that?
Well, there are some things you have to be concerned with any medication, and that's why these videos are just general information, and you always need to, as you mentioned earlier, confer with your practitioner. But one thing that this is technically a monoamine oxidase inhibitor, MAOI inhibitor. So there's certain drug interactions. So things like fluoxetine or Prozac or Zoloft or sertraline, Cymbalta, duloxetine. There's different drugs that increase serotonin and norepinephrine. Those drugs would not be a good idea to take with that. Also, people who have a history of pretty severe kidney disease, probably not a good idea, just because it's got to be cleared through the kidneys. So that would be another thing.
And you were talking about the serotonin uptake stuff. That's things like Zoloft and whatever.
Exactly, yeah, things that increase the serotonin or norepinephrine things. More things that are antidepressant medicines, which a person who's taking this, again, because this one of the things we mentioned this was
the
looked at.
depression was mentioned there.
Yeah, so
you may be taking one of these.
Right, so it's likely that you're maybe on something like that, so this may not be the right choice for you to go to.
Right, or anything kidney related, I guess.
Well, kidney, if you have kidney disease or kidney compromised kidneys, But I'm talking about more severe kidney disease.
Gotcha. Gotcha. Interesting. So, what about side effects and things of that nature then?
Well, I mean, like with most things, there's some GI upset. I think that's the most common thing. Sometimes
blue GI upset.
Huh?
Blue GI upset.
Your GI tract gets very blue. It's sad. But headaches and dizziness and the GI side effects are most common. Sometimes people need to, do a reset. So I find that sometimes people have been on it. They didn't do well on it the first 5 days a week, and then we give them 48 hours off and then restart it. The other thing with dosing too, that we're usually dose 6 days a week. Usually take 1 day off a week. But it's important to do that, and it's also important to know where to get methylene blue, because this is a bottle of reagent grade methylene blue. Now this we have in our lab. Many labs use this. You stain cells, you look at things under a microscope. Sure. So people sometimes buy this because this is the 1% methylene blue. But what you don't understand, when you're making this for reagent purposes, they don't have to purify it so that there's 8 to 10% heavy metal in this,
wow.
Lead and arsenic and other things.
Zeppelin?
Yeah, lead Zeppelin, that's right. Dazed and confused if you take too much methylene blue. But anyway, so you don't want, people sometimes think that they can go buy this on Amazon or some other place and get, and I don't need to buy some expensive thing, but if you're taking it orally, you need to have the impurities be at a certain level, right? And this level set by the government is 0.5%
for impurities.
For impurities.
That's
now,
USP standard?
That's USP standard,
okay.
So that's the highest standards there are. But the one that we actually source is 0.05%, so that's much, much lower than that. Wow. And again, either way, much less lower than 8 to 10%, which is in here. This has got heavy metals in it. This could be poisonous to a person. They should never take this orally.
Wow, and yet it's still being sold out there.
Well, I mean, again, it's used for other purposes.
Yeah, sure,
so that's
sure.
So people, they don't know, what people are going to do with it.
Yeah, so I guess it kind of behooves the patient in general to, one, be careful about where you're buying stuff and where you're sourcing things, and two, also work with a practitioner who's informed on these sorts of things as well.
Right, yeah. Again, yeah, because as a supportive agent, this is something that's really promising. And again, paired with another compounded medication like LDN, it could be the answer to a person's problems, whether it's with the Alzheimer's, autism, depression, all those things.
Yeah, it certainly sounds interesting and worth exploring as an option. So any other questions, feel free to reach out to us at HB Pharmacy. Our contact information is here. And other than that, thank you again, sir, for your time, and we look forward to seeing you in the next episode.
See you. Thanks.